Paracetamol Acetaminophen. Expanded lecture note. Welcome to our channel. Today, we're going to explore one of the most widely used medications in the world, paracetamol, also known as acetaminophen. From pain relief to fever reduction, this medication has been a staple in many medicine cabinets for decades. But how much do we really know about paracetamol? In this video, we'll dive into its history, mechanism of action, uses, side effects, and more. Whether you're a healthcare professional or just looking to learn more about this common medication, this video is for you. So let's get started and take a closer look at paracetamol. Objectives. By the end of this presentation, learners should be able to 1. Define paracetamol acetaminophen and understand its pharmacological role. 2. Describe its history, myths, and clinical importance. 3. Discuss its classification, chemical and physical properties. 4. Explain its mechanism of action, pharmacokinetics, and pharmacodynamics. 5. Outline safe storage, disposal, and drug interactions. 6. Highlight clinical uses in ICU, anesthesia, and emergencies. 7. Identify dosage regimens, side effects, contraindications, and precautions. 8. Evaluate its advantages, disadvantages, and clinical considerations. 9. Compare with other analgesics and antipyretics. 10. Appreciate current research trends and patient education needs. 11. Summarize with practical take-home points and a professional reflection. Other names. 1. Generic name, paracetamol acetaminophen. 2. Trade names, Panadol, Tylenol, Calpol, Crocin, Mapop. 3. Abbreviations. APAP, from its chemical name N-acetyl-para-aminophenol. Introduction to paracetamol. 1. Most widely used medication. Paracetamol is the most widely used analgesic and antipyretic worldwide, making it a staple in many medicine cabinets. 2. Safety profile. While considered safe at therapeutic doses, paracetamol can be potentially fatal in overdose due to hepatic toxicity, emphasizing the importance of proper dosing. 3. Effective pain relief. Research findings suggest that paracetamol provides effective pain relief equivalent to NSAIDs in mild to moderate pain, making it a reliable option for managing pain. 4. Limited anti-inflammatory effects. Unlike NSAIDs, paracetamol has no significant anti-inflammatory or antiplatelet activity, which sets it apart from other pain relief medications. 5. First-line treatment. Paracetamol is considered a first-line drug for treating fever, headache, musculoskeletal pain, and is often used in pediatric care due to its safety profile. 6. Essential medicine. The World Health Organization (WHO) includes paracetamol in the essential medicines list, recognizing its importance in meeting the priority health care needs of the population. The myths about paracetamol. Myth 1. It is completely harmless. Fact. Safe within therapeutic range, but overdose causes acute liver failure. Myth 2. It is an anti-inflammatory. Fact. It has negligible peripheral anti-inflammatory action. Myth 3. Safer than ibuprofen in all patients. Fact. Safer for GI, but dangerous in alcoholics and liver disease. Myth 4. It cannot cause death. Fact. Paracetamol overdose is one of the leading causes of drug-induced liver failure worldwide. Classical definition of paracetamol. Paracetamol acetaminophen is a non-opioid analgesic and antipyretic agent with weak peripheral anti-inflammatory action, commonly used for mild to moderate pain and fever reduction. 1. Non-opioid analgesic. Paracetamol is a non-opioid analgesic, meaning it does not belong to the opioid class of pain relievers and does not carry the same risk of addiction. 2. Analgesic and antipyretic agent. Paracetamol is used to relieve pain, analgesic, and reduce fever, antipyretic, making it a versatile medication for managing various symptoms. 3. Weak peripheral anti-inflammatory action. Paracetamol has weak anti-inflammatory effects, particularly in peripheral tissues, which distinguishes it from stronger anti-inflammatory medications like NSAIDs. 4. Mild to moderate pain relief. Paracetamol is commonly used for mild to moderate pain relief, making it suitable for managing everyday aches and pains. 5. Fever reduction. Paracetamol is effective in reducing fever, which can help alleviate discomfort and support the body's recovery process. History of paracetamol. 1. Discovery. Paracetamol was discovered in the late 19th century as a metabolite of acetanilide, a compound used in the production of dyes. 2. Early clinical use. Paracetamol was first used clinically in 1893, but it didn't gain widespread acceptance immediately. 3. Rise to popularity. Paracetamol became popular in the 1950s as a safer alternative to aspirin, particularly for patients at risk of gastric irritation or bleeding, which can be a significant side effect of aspirin use. 4. Global adoption. Paracetamol has been widely adopted worldwide for pain and fever management, and is available both over the counter and in hospitals, making it a staple in many medicine cabinets. 5. Widespread use. Today, paracetamol is one of the most widely used medications globally, and is often the go-to choice for managing mild to moderate pain and fever. Classification of paracetamol. 1. Pharmacological class. Paracetamol belongs to the pharmacological class of analgesic and antipyretic agents, meaning it is used to relieve pain and reduce fever. 2. Therapeutic class. Therapeutically, paracetamol is classified as a non-opioid analgesic and antipyretic, distinguishing it from opioid-based pain relievers and highlighting its specific uses. 3. WHO classification. Paracetamol is classified as an essential medicine by the World Health Organization, WHO, recognizing importance in meeting the priority health care needs of populations and its role in managing pain and fever. Chemical properties of paracetamol. 1. Chemical name. The chemical name of paracetamol is N,4-hydroxyphenyl acetamide, which describes its molecular structure and composition. 2. Molecular formula. The molecular formula of paracetamol is C8H9 number 2, which indicates the number and types of atoms present in the molecule. 3. Molecular weight. The molecular weight of paracetamol is 151.16 grams per mole, which is a measure of the total mass of the atoms in the molecule. 4. Structure. Paracetamol is a para-aminophenyl derivative, meaning it is structurally related to other compounds in this class and has specific chemical properties that contribute to its pharmacological effects. Physical properties of paracetamol. 1. Appearance. Paracetamol appears as a white crystalline powder, which is a characteristic physical form of the substance. 2. Melting point. The melting point of paracetamol is approximately 169 to 170 degrees Celsius, which is a specific temperature range at which the solid changes to a liquid state. 3. Solubility. Paracetamol is soluble in alcohol and slightly soluble in water, which affects its formulation and administration. 4. Formulations. Paracetamol is available in various formulations, including oral tablets, capsules, oral suspension, IV solution, and suppositories, which provide different options for administration and use. Mechanism of action of paracetamol. 1. Central inhibition of COX enzymes. Paracetamol works by inhibiting cyclooxygenase COX enzymes in the brain, primarily COX2, which plays a role in pain and fever regulation. 2. Reducing prostaglandin synthesis. By inhibiting COX enzymes, paracetamol reduces the synthesis of prostaglandins, which are chemicals that contribute to pain and fever. 3. Increases pain threshold. The reduction in prostaglandin synthesis increases the pain threshold, making it more difficult for pain signal to be transmitted to the brain. 4. Reduces fever. Paracetamol also acts on the hypothalamic heat-regulating center to reduce fever, helping to restore normal body temperature. 5. Minimal peripheral COX inhibition. Unlike other medications, paracetamol's minimal effect on COX enzymes in peripheral tissues, which means it has little to no anti-inflammatory effect. Pharmacokinetics of paracetamol. 1. Absorption. Paracetamol is rapidly and completely absorbed after oral administration, with a bioavailability of approximately 60 to 90%, meaning most of the dose enters the bloodstream. 2. Distribution. Paracetamol is widely distributed in body fluids, crosses the placenta, and small amounts are found in breast milk, indicating its potential effects on the fetus and nursing infants. 3. Protein binding. Paracetamol has relatively low protein binding, 10–25%, which affects its distribution and elimination in the body. 4. Metabolism. Paracetamol undergoes hepatic conjugation, glucuronidation and sulfation, and minor metabolism by 2 × 10⁻⁻⁴ cypriot pounds to form a toxic metabolite called NAPQI, which is normally neutralized by glutathione. 5. Elimination. Paracetamol is primarily eliminated through renal excretion, mainly as conjugates, which are then excreted in the urine. 6. Half-life. The half-life of paracetamol is 2 to 3 hours, but it may increase in cases of overdose or hepatic impairment, which can affect its clearance and toxicity. Pharmacodynamics of paracetamol. 1. Onset. The onset of action for paracetamol is 30 to 60 minutes when taken orally, and 5 to 10 minutes when administered intravenously (IV), indicating how quickly the effects can be expected to start. 2. Peak effect. The peak effect of paracetamol occurs 1 to 2 hours after oral administration, which is when the medication is most effective in relieving pain and reducing fever. 3. Duration. The duration of paracetamol's analgesic and antipyretic effects is 4 to 6 hours, indicating how long the medication provides relief from pain and fever. 4. Effects. Paracetamol's primary effects include analgesia, pain relief, fever reduction, and minimal anti-inflammatory activity, making it suitable for managing mild to moderate pain and fever. Storage and disposal of paracetamol. 1. Storage. Paracetamol should be stored at room temperature, protected from light and moisture, to maintain its potency and effectiveness. 2. Protection from contamination. IV formulations of paracetamol should be used within the recommended time after opening to prevent contamination and ensure sterility. 3. Proper disposal. Unused or expired paracetamol should be disposed of according to local regulations, which may vary depending on the region or country. 4. Environmental consideration. It is recommended to avoid flushing paracetamol into water systems, as this can potentially harm aquatic life and contaminate water sources. Drug interactions of paracetamol. 1. Alcohol and hepatotoxins. Combining paracetamol with alcohol or other hepatotoxic substances increases the risk of liver injury, as both can cause liver damage. 2. Warfarin. Chronic use of paracetamol may increase the anticoagulant effect of warfarin, potentially leading to an increased risk of bleeding. 3. Enzyme inducers. Certain medications like rifampicin, carbamazepine, and phenytoin can induce enzymes that increase the metabolism of paracetamol, potentially leading to increased toxicity risk. 4. Cholestyramine. Taking cholestyramine with paracetamol can reduce the absorption of paracetamol, potentially decreasing its effectiveness. Clinical uses of paracetamol. 1. Mild to moderate pain. Paracetamol is effective in managing mild to moderate pain, including headache, musculoskeletal pain, and dental pain, making it a common over-the-counter medication. 2. Fever reduction. Paracetamol is used to reduce fever in both adults and children, helping to alleviate discomfort and support the body's recovery process. 3. Multimodal analgesia. Paracetamol is often used as part of multimodal analgesia in surgical patients, combining different medications and techniques to achieve effective pain relief. 4. Postoperative pain management. Paracetamol can be used to manage postoperative pain, reducing the need for other pain medications and minimizing potential side effects. 5. Alternative to NSAIDs or opioids. Paracetamol is a suitable option for pain relief in patients with contraindications to NSAIDs or opioids, such as those with bleeding disorders or opioid intolerance. Use of paracetamol in ICU. 1. First-line treatment. Paracetamol is often used as a first-line treatment for mild to moderate pain in critically ill patients, providing effective pain relief while minimizing potential side effects. 2. Opioid-sparing effect. Paracetamol's opioid-sparing effect makes it a valuable component of multimodal analgesia protocols in the ICU, reducing the need for opioids and their potential side effects. 3. IV formulation. The IV formulation of paracetamol is particularly useful in the ICU when the oral route is not feasible, such as in patients who are intubated or have gastrointestinal issues, allowing for continued pain management. Use of paracetamol in anesthesia. 1. Preoperative or intraoperative administration. Paracetamol can be administered before or during surgery to help control postoperative pain, reducing the need for other pain medications. 2. Combination therapy. Paracetamol is often combined with NSAIDs and opioids to enhance analgesia, providing more effective pain relief through a multimodal approach. 3. IV paracetamol in day case surgery. IV paracetamol is favored in day case surgery due to its ability to facilitate faster recovery, allowing patients to be discharged sooner and return to their normal activities. Use of paracetamol in emergencies. 1. Fever reduction. Paracetamol is used to reduce high fevers, helping to alleviate discomfort and prevent potential complications associated with elevated body temperature. 2. Pain control. Paracetamol is effective in controlling pain in minor trauma or non-life-threatening conditions, providing relief for patients in emergency situations. 3. Adjunct in severe pain. As part of multimodal therapy, paracetamol can be used as an adjunct in severe pain management, complementing other pain medications to achieve optimal pain relief. Nursing management of paracetamol. 1. Baseline liver function. Checking baseline liver function is important in patients taking paracetamol long-term, as it can help identify potential liver damage or risks. 2. Monitoring temperature and pain score. Regularly monitoring temperature and pain score helps nurses assess the effectiveness of paracetamol in reducing fever and managing pain. 3. Avoiding overdose. Nurses should be aware of the maximum adult dose of paracetamol, 4 g per day, and take steps to avoid overdose, which can lead to liver damage and other complications. 4. Patient education. Educating patients on avoiding duplicate products that contain paracetamol, such as cold medicines, can help prevent accidental overdose and ensure safe use. Administration and dosage of paracetamol. 1. Adults, oral, rectal. The typical dose is 500, 1000 mg every 4 to 6 hours, with a maximum daily dose of 4 grams to ensure safe and effective use. 2. Adults, IV. The recommended dose is 1 gram every 6 hours or 650 milligrams every 4 hours, with a maximum daily dose of 4 grams to achieve optimal pain relief and fever reduction. 3. Children, oral, rectal. The dose is calculated based on weight, typically 10 to 15 mg per kilogram every 4 to 6 hours, with a maximum daily dose of 60 mg per kilogram to ensure safe and effective use in pediatric patients. 4. Children, IV. The recommended dose is 15 mg per kilogram every 6 hours or 12.5 mg per kilogram every 4 hours, with a maximum daily dose 60 mg per kilogram to provide effective pain relief and fever reduction. 5. Special considerations. In patients with hepatic impairment or chronic alcohol use, the maximum daily dose should be reduced to 2 to 3 g to minimize the risk of liver damage and ensure safe use. Side effects of paracetamol. 1. General tolerance. Paracetamol is generally well tolerated at therapeutic doses, making it a popular choice for pain relief and fever reduction. 2. Nausea. Nausea is a possible side effect, although it is relatively rare, and can be uncomfortable for patients. 3. Rash. A rash can occur in some individuals, although this is a rare side effect, and may require medical attention if severe. 4. Liver enzyme elevation. Mild elevation of liver enzymes can occur, indicating potential liver stress, although this is often reversible and may not lead to significant liver damage. Serious side effects of paracetamol. 1. Hepatotoxicity. Overdose of paracetamol can lead to hepatotoxicity due to the accumulation of NAPQI, a toxic metabolite that can cause liver damage. 2. Acute liver failure. In severe cases, paracetamol overdose can cause acute liver failure, a life-threatening condition that requires immediate medical attention. 3. Anaphylaxis. Although rare, anaphylaxis can occur, particularly with the IV form of paracetamol, and is a severe, potentially life-threatening allergic reaction. 4. Severe skin reactions. Rare but serious skin reactions, including Stevens-Johnson syndrome and toxic epidermal necrolysis, can occur, requiring prompt medical attention to prevent long-term damage. Contraindications of paracetamol. 1. Hypersensitivity. Paracetamol is contraindicated in individuals with a known hypersensitivity to the medication, as it can cause allergic reactions. 2. Severe hepatic impairment. Patients with severe liver damage or impairment should not take paracetamol, as it can further worsen liver function. 3. Active liver disease. Paracetamol is contraindicated in patients with active liver disease, as it can exacerbate liver damage and impair liver function. 4. Severe alcoholism. Individuals with severe alcoholism should avoid paracetamol, as chronic alcohol use can increase the risk of liver damage and toxicity. Precautions with paracetamol. 1. Chronic alcohol use. Patients with a history of chronic alcohol use should exercise caution when taking paracetamol, as it increases the risk of hepatotoxicity and liver damage. 2. Malnutrition. Individuals with malnutrition may have low glutathione reserves, making them more susceptible to liver damage from paracetamol, and requiring careful consideration when using the medication. 3. Concurrent hepatotoxic drugs. Taking paracetamol with other hepatotoxic drugs can increase the risk of liver damage, and patients should be monitored closely for signs of liver toxicity. 4. Renal impairment. In patients with severe renal impairment, the dosing interval of paracetamol may need to be adjusted to prevent accumulation and potential toxicity. Advantages of paracetamol. 1. Wide availability and affordability. Paracetamol is widely available and inexpensive, making it an accessible option for pain relief and fever reduction. 2. Safety in various populations. Paracetamol is considered safe for use in most populations, including children and pregnant women, when taken at therapeutic doses, providing a reliable option for pain management. 3. Minimal gastrointestinal irritation. Unlike some other pain medications, paracetamol causes minimal gastrointestinal irritation, reducing the risk of stomach upset and other digestive issues. 4. No significant effect on platelet function. Paracetamol does not significantly affect platelet function or bleeding risk, making it a suitable option for patients who are at risk of bleeding or taking anticoagulant medications. Disadvantages of paracetamol. 1. Limited anti-inflammatory effect. Paracetamol does not have significant anti-inflammatory activity, which may limit its effectiveness in certain conditions where inflammation is a major component. 2. Risk of toxicity. The margin between the therapeutic dose and the toxic dose of paracetamol is relatively narrow, making it possible to accidentally overdose and increasing the risk of liver damage. 3. Dose adjustment in liver disease. Patients with liver disease require dose adjustment to avoid accumulation and potential toxicity, which can challenge in managing their treatment. Clinical considerations for paracetamol. 1. Maximum daily dose. It is crucial to avoid exceeding the maximum daily dose of paracetamol to prevent liver damage and potential toxicity. 2. Hidden paracetamol in combination products. Patients should be educated about the presence of paracetamol in combination products, such as cold and flu medications, to avoid accidental overdose. 3. N-acetylcysteine in overdose. In cases of paracetamol overdose, N-acetylcysteine should be administered promptly to replenish glutathione and prevent liver damage, highlighting the importance of timely treatment. 4. IV route in specific settings. The IV route of paracetamol is preferred in perioperative or ICU settings where oral administration is not feasible, ensuring that patients receive effective pain relief and fever reduction. Comparison of paracetamol with other agents. Analgesic effect. Paracetamol provides mild to moderate analgesia, suitable for managing mild to moderate pain. NSAIDs offers mild to moderate analgesia, effective for managing pain and inflammation. Opioids provides moderate to severe analgesia, often used for managing severe pain. Antipyretic effect. Paracetamol effective in reducing fever. NSAIDs also effective in reducing fever. Opioids does not have antipyretic properties. Anti-inflammatory effect. Paracetamol has minimal anti-inflammatory effect. NSAIDs has strong anti-inflammatory properties, making them effective for managing inflammatory conditions. Opioids does not have anti-inflammatory effects. Gastrointestinal effects. Paracetamol minimal gastrointestinal effects, making it a suitable option for patients with sensitive stomachs. NSAIDs high risk of gastrointestinal side effects, such as stomach ulcers and bleeding. Opioids can cause constipation, but not typically associated with stomach ulcers or bleeding. Bleeding risk. Paracetamol no significant bleeding risk. NSAIDs increased bleeding risk due to their effect on platelet function. Opioids no significant bleeding risk. Safety in liver disease. Paracetamol use with caution, as it can cause liver damage in overdose or with prolonged use. NSAIDs generally safe, but may require caution in certain liver conditions. Opioids generally safe, but may require dose adjustment in liver disease. Safety in renal disease. Paracetamol safe for use in renal disease, but may require dose adjustment in severe cases. NSAIDs use with caution, as they can worsen kidney function. Opioids generally safe, but may require dose adjustment in renal disease. Additional information about paracetamol. 1. Combination with opioids. Paracetamol is often combined with opioids, such as codeine, to provide synergistic analgesia, enhancing pain relief and allowing for more effective management of moderate to severe pain. 2. IV formulation. Paracetamol is a prodrug that is rapidly converted to paracetamol in the body, providing a convenient IV formulation for patients who require parenteral administration. 3. WHO Essential Medicines List. Paracetamol is listed as a first-line analgesic and antipyretic on the World Health Organization's Essential Medicines List, recognizing its importance as a fundamental medication for pain relief and fever reduction worldwide. Current trends in paracetamol. 1. Increasing use of IV paracetamol in surgical and ICU patients. IV paracetamol is gaining traction in medical settings for managing moderate to severe pain, particularly in surgical environments and ICUs, as it provides quicker relief with fewer side effects compared to opioids, helping reduce opioid consumption. 2. Growing public health campaigns. Public health campaigns are emphasizing the importance of safe usage and potential risks associated with paracetamol, particularly in preventing accidental overdose from combination product, which can lead to liver damage. 3. Research into post-COVID fever and myalgia management. While specific research findings on paracetamol's role in post-COVID fever and myalgia management are not readily available, the medication remains a popular choice for managing mild to moderate pain and fever, and its effectiveness in various conditions continues to be studied. Patient education for safe use of paracetamol. 1. Take the correct dose. Patients should be instructed to take the recommended dose of paracetamol, not exceeding the maximum daily dose of 4 grams for adults, to minimize the risk of liver damage. 2. Avoid combining with alcohol. Patients should be advised to avoid consuming alcohol while taking paracetamol, as this can increase the risk of liver damage and toxicity. 3. Read labels of OTC drugs. Patients should be educated to read the labels of over-the-counter OTC medications, as many may contain hidden paracetamol, which can lead to accidental overdose. 4. Report adverse effects. Patients should be instructed to report any signs of adverse effects, such as jaundice, nausea, or unusual tiredness, to their healthcare provider promptly, allowing for timely intervention and prevention of potential complications. Conclusion on paracetamol. 1. First-line analgesic and antipyretic. Paracetamol remains a widely used and recommended first-line treatment for pain relief and fever reduction due to its favorable safety profile, affordability, and effectiveness in various patient populations. 2. Safety and effectiveness. Despite lacking significant anti-inflammatory properties, paracetamol's safety and effectiveness make it an essential medication for managing pain and fever in a broad range of patients, including children, pregnant women, and individuals with certain comorbidities. 3. Role in multimodal analgesia. Paracetamol plays a crucial role in multimodal analgesia, where it is often combined with other pain medications to achieve optimal pain relief while minimizing side effects, highlighting its versatility and value in modern pain management. 4. Indispensable in modern medicine. Paracetamol's importance extends to various medical settings, including ICU, anesthesia, and emergency care, where its effectiveness in pain management and fever control contributes significantly to patient care and outcomes. Take-home tips for paracetamol use. 1. Calculate total daily dose. Always calculate the total daily dose of paracetamol to avoid exceeding the maximum recommended dose and minimize the risk of liver damage. 2. Monitor liver function. Regularly monitor liver function in patients who are chronic users of paracetamol to detect potential liver damage early and prevent long-term consequences. 3. Safe choice in specific populations. Paracetamol is a safe choice for pain relief and fever reduction in pregnant women, pediatric patients, and individuals with gastric issues, due to its favorable safety profile and minimal side effects. 4. Be alert for combination products. Be aware of combination products that contain paracetamol, such as cold and flu medications, to avoid accidental overdose and ensure safe use. 5. Start NAC in overdose. In cases of paracetamol overdose, start N-acetylcysteine (NAC) immediately to replenish glutathione stores and prevent liver damage, highlighting the importance of timely treatment. Professional quote. On paracetamol. Paracetamol is the quiet workhorse of pain medicine, safe, steady, and indispensable when used wisely. Analgesia practice principle. This quote highlights paracetamol's reliability and importance in pain management, emphasizing safety and effectiveness when used correctly. The term, quiet workhorse, suggests that paracetamol may not always receive the attention it deserves, but it remains a fundamental and essential medication in the management of pain and fever. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.